everyone, my name is Shaughnessy Nordstrom, and today I'm going to be talking about an introduction to public health. I'll be covering what public health is, why it matters, and different factors that impact the health of populations. So this is my table of contents. Just go to the next slide. What is public health? Public health focuses on improving the health of entire populations rather than just individuals. Instead of treating people after they get sick, public health works on preventing diseases before they happen. This includes things like promoting healthy behaviors, making sure people have access to clean water, like vaccines, and healthcare. Overall, the goal is to improve quality of life and reduce health risk for everyone. What does public health mean to me? To me, public health is very personal. As someone who plays Division One basketball, I see how important it is to take care of my body through prevention, like eating right, staying hydrated, and recovering properly. It's kind of like non-negotiables for me. Probably like non-negotiables for how public health works. Um, Being from New Zealand also showed me how environment and access to resources affect health. So for me, public health is about taking care of yourself and making sure communities have the support they need to stay healthy. Um, yeah. Some social determinants of health. Social determinants of health are the conditions in which people are born, live, and work. These factors like education, income, environment, and access to healthcare play a huge role in someone's health. For example, someone living in a safe neighborhood with access to healthy food and good schools is more likely to have better health outcomes compared to someone without those resources. So these factors help explain why some communities experience more health issues than others, I would say. Um, Health equity and my Christian perspective. Um, so health equity basically means that everyone has a fair opportunity to be as healthy as possible, no matter their background or where they live. It focuses on removing barriers like lack of healthcare access or poor living conditions. Um, from a Christian perspective, this connects to the idea that everyone is created equally and should be treated with fairness and compassion. Personally, having access to health resources allows me to stay active and pursue basketball, which shows how important equity really is. Here is a link to one of my favorite articles that talks about health equity in a Christian perspective. Um, Roles of government and non governmental organizations. So basically, public health is supported by both government and non government organizations. They create laws and programs to protect people's health, like ensuring safe food, water, and vaccines. Organizations like the Centers for Disease Control and even prevention track diseases and respond to outbreaks. Non government groups like the American Red Cross or the World Health Organization help provide services globally, like during um, emergencies. When these big groups work together, they can make a bigger impact. So the three core health functions, public health functions. These are the three main functions of public health, which is assessment, health policy development, and assurance. First, I would say assessment means identifying health problems in communities. Policy development is like creating plans or laws to address those issues or problems. And then there's assurance, ensures that those plans are actually working and that people have access to care. Basically, I would say it's like identifying a problem, creating a solution, and then making sure it works. History of public health. So, achievements in public health, there's a lot, and I would say that they have definitely advanced through years of public health. Um, Public health has made huge achievements over time, which like I just said. Vaccination programs have reduced diseases like polio and measles. Improvements in sanitation and clean water have lowered infection rates. There have also been major improvements in maternal and child health, tobacco control, and road safety. These efforts have helped people live longer and healthier lives overall. Um, this is like a graphical timeline I made, um, and it, like how public health has evolved over time. In the 1800s, John Snow discovered that cholera has linked to contaminated water, which helped like kind of start epidemiology. In the 1950s, the introduction of polio vaccine um, saved many lives and provided many people with protection from an infectious disease. And then there's in 1964 a major report linked smoking to lung cancer, leading to tobacco control efforts. Um, the 2000s, uh, mRNA vaccines for COVID-19 have shown how important modern science is in public health. Environmental achievements. Kind of love this one. Uh, One of the best and biggest public health achievements is improving water and sanitation. In the past, diseases like cholera spread through contaminated water, like I just said. By building water treatment systems and improving sanitation, millions of lives have been saved. This is a major reason why people today live longer and healthier compared to the past. I put there like something from an article I found in National Academics of Sciences, Engineering, and Medicine. Um, Clinicians caring for individuals who are potentially exposed to drinking water contaminated by jet fuel accidentally released on Oahu, Hawaii in November 2021 should document exposure history, carefully evaluate systems, and ensure continuity of primary care as evidence continues to evolve, says a new report from the National Academics of Sciences, Engineering, and Medicine. So the report also calls for continued environmental oversight of the drinking water system, research to improve exposure characterization, health research, surveillance of the exposed community, and other efforts to rebuild trust. So that was kind of like a little thing that I thought was really cool that kind of supported like how we continue to make those environmental achievements in public health. A current issue in public health, I would say, is health disparities. So this can mean a lot of things. This means that different groups of people have like different levels of access to healthcare based on factors like income, location, or education. For example, people in rural or low income areas may not have access to doctors or safe housing. Public health needs to focus not just on treating disease, but also on these social factors. I think this is really important just because it helps not only like one group but another group. Um, it's also being able to provide a focus on the social part of public health and the nitty gritty things. A solution to this, to help reduce disparities, we can build more clinics in undeserved areas, provide affordable healthcare, and improve insurance coverage. Education is also really important to people so they understand their health and how to seek help. Overall, I would say the goal is to make healthcare more fair and accessible for everyone. I know we care acts, institutions where like that can help with that. Obviously it's not for everyone, but it would be pretty cool if like we found a solution to help people that don't have the green card or immigrants. I'm originally from New Zealand and I just got my green card about 2 weeks ago, so we don't get a lot of those benefits that you guys have provided with. While the US healthcare has provided with like the Affordable Care Act and other institutions, like it doesn't benefit immigrants that are on certain visas. Like it would benefit me now just because I got the green card and citizens of the United States, but it doesn't um, help and benefit immigrants, which would be pretty cool if we could find a solution to that. So skills needed. To improve public health in the future, professionals, I would say, yeah, they just need strong skills. This includes using data and technology to track diseases, working with, the community, and focusing on prevention. Um, Communication and empathy are also really important, I would say, especially for doctors and healthcare workers. Being able to understand patients and advocate for them can make a big difference in outcomes. Um, I know communication and empathy seem really cliche, but I would say, it is very important because people like to feel wanted and supported in whatever they're doing, especially their body, and they trust you. They start trusting you and being on the same wavelength as you when you suggest things in a empathetic way and you communicate well. Best achievement in the future, I would say, like in the next 25 years, is finding a cure for cancer. I know there's been chemo or whatever, well, obviously kills the toxins, tries to, but kills um, the tumor spread, but it doesn't always kill it because there's still um, things in there, especially if you have stage four. Um, Cancer affects millions of people and has personally impacted my family. Finding a cure would not only save lives but also reduce emotional and physical suffering for families. That's why I believe it would be one of the most important breakthroughs in public health. So I had an auntie that passed away 2 years ago, and an auntie that passed away about 6 years ago, and then a grand auntie, well, grand aunties, two of them that passed away like a lot of years ago from breast cancer. It's not um, it's not fun at all. I would say like if public health were to be able to provide a cure for that, it would help a lot of people because people obviously don't deserve that, and it's hard right now to find a cure. I mean, there is chemo, but you don't want to go through those remission stages. So I think um, it would definitely help. And resources like the National Cancer Institute, like I put down there, provide you with trustworthy information and current solutions to cancer that could help your people in need. But so far, there's no for sure cure to cancer, especially stage four. These are my references.